if a kid is being affected with meningitis and if the doctor wants to make out the final diagnosis of the exact cause of meningitis, say for example, if he wants to know what is the reason of this meningitis, is it viral or is it bacterial meningitis, the physician will have to take a sample of the CSF that is being draining around the subarachnoid space into the dural venous sinuses. So when the physician is going to take a sample of it, so the procedure that he normally does is called as a lumbar puncture. The needle is being inserted into the subarachnoid space, and hereby the physician is going to withdraw a sample of the CSF. So this is going to be a diagnostic lumbar puncture, because the physician has now taken the fluid in order to determine the cause of such infections. Sometimes what can happen is, in a case of hydrocephalus or in case of some tumors blocking the production and the transmission of these CSF, the physician will go to let off the excessive CSF if it's a case of a hydrocephalus or any tumors that resulting in the overproduction of the CSF, especially a tumor in the ependymal cells of the lateral ventricles. In such cases, the excess fluid is now being drained out and this becomes a therapeutic lumbar puncture. Imagine a physician is performing a repeated lumbar puncture. Sometimes what happens is it might result in a dry tap. What do you mean by a dry tap is like, despite making multiple efforts to drain the CSF, there may not be adequate CSF. So this is called as a dry tap. So when a physician has done repeatedly such procedure, what happens is there is a tendency for the CSF to leak. So this is called as a CSF leak, and sometimes patient might have some intractable headache as well. At such times, what the physician does is he has to repair the punctured site, right? So in such cases, a physician takes an autologous blood sample of the patient's own blood and then he makes it as a blood clot and then he repairs the punctured site. Sometimes this is also called as a patch or a blood clot patch procedure. So for that also we have a very specific code.